Welcome, everyone. Happy Valentine's Day. Thank you for joining us today at OneLegacy's Connecting the Dots Town Hall event. This month, we're celebrating Black History Month, and we're also coming together today on National Donor Day to discuss the importance of improving health equity and organ donation, especially amongst communities of color. Just giving a bit of a background on OneLegacy for those of you who may be new in our audience. OneLegacy is part of a national organ donation network made up of 57 nonprofit organizations that works with hospitals, physicians, transplant centers, donor families, and the community to educate about the importance of organ donation for patients in need. And that's essentially patients on the transplant waiting list. Our service area spans from Kern County all the way to Santa Barbara and counties in between, covering over 20 million people in Southern California. It's one of the most diverse populations in our nation. OneLegacy is the bridge for families in Southern California, driven by a mission of hope and healing. OneLegacy connects donor patients and helps save and improve thousands of lives every year. We work in partnership with the communities that we serve to raise awareness about the need to donate. And we work closely with those centers and also our community leaders and stakeholders like those that will be on this panel with us today. As we jump into this conversation, the transplant list is a very diverse list, both in age and race. According to the census, about 13.4% of the national population are Black Americans. And here in Southern California, 7% of that population are African Americans. However, Black and African Americans make up the largest group of minorities in need of an organ transplant. That's about 28.5% of the list. And despite this, we know that there's a huge gap. And we're going to talk today about how to advance equity and how we can close that gap. So let's start with some of our panelists that are here with us today. I will be joined by Rhonda Smith. Hello, Rhonda. She is the Executive Director of the California Black Health Network. And Rhonda currently serves there. She also previously was the Executive Director of the LifeServe Youth Foundation. And she also was the Executive Director for Integrative Medicine for the Underserved, which is IM4US. Hello, Rhonda, and welcome.
Hey, Tiffany. Thanks. I'm happy to be here today.
Joining this conversation, we also have Pastor William D. Smart Jr., President and CEO of the Southern Christian Leadership Conference of Southern California. He's also the co-pastor of the Christ Liberation Ministries in Los Angeles, where his wife serves as the senior pastor. And then we have our very own OneLegacy ambassador and heart transplant recipient, Lavinia Brooks, otherwise known as Miss Vinny, as I call her. And Lavinia, she received her heart transplant. She now uses her second chance at life to continue pursuing her career as a published author and motivational speaker. She also volunteers diligently around the clock here at OneLegacy to inspire others to become organ, eye, and tissue donors. And as we are about to dive into our town hall discussion, I want to let everyone know that we will spend about the last 20 minutes of our town hall to answer your questions. There is a chat feature, and we ask that you will submit your questions, and we will answer them at the end. There is also an opportunity to submit a survey so you can tell us some of the conversations that you would like to see as part of our Connecting the Dots Town Hall platform. So let's get right into it. I gave just a brief introduction of each of you, but I want you to walk us through your background and your organization and the work you lead. So can we start with you, Rhonda?
Thank you. So I am the Executive Director of the California Black Health Network. And for those of you in the audience who may not be familiar with us, even though we've been around for nearly 40 years, we are an organization, a statewide organization that works to advance health equity for Black Californians. That includes African Americans and Black immigrants, regardless of what country they're from. And so part of our work involves outreach and education, advocacy and policy, to really make the kind of changes that we need to at the individual, community, and system level focusing more so on the system level so that we can address the structural inequities that exist that contribute to health disparities and unfortunately disparities across the board, from maternal health and infant mortality all the way to end of life issues and everything in between. So, and do you want me to tell a little bit about my personal journey and how I got to do this work?
Sure, go ahead. Share with us.
So I really came to do this work because of my own personal health story and journey through breast cancer, and recognized as part of that work that there were women who unfortunately didn't have access to a lot of the resources that I was fortunate enough to have when I went through my journey. And that was my first exposure to health disparities. And I really wanted to do something to help the women, and was living in South Florida at the time. So very diverse population of Black women, to make sure that they had the best chance to, to survive breast cancer and have better outcomes than what I understood about what was happening with women in South Florida. And so I really became very passionate about that cause and wanting to make sure that no other woman of color and or person of color really died from diseases they shouldn't be dying from. So we work every day to prevent that from happening. At least we try to do our best to prevent that from happening here in California. So.
Thank you, Rhonda, and thank you for the work you do. It's very important. So let's continue with this question. Give us a little bit of the background about your organization, the work you lead, and then, tell us why you're an advocate for health equity. Pastor Smart.
Well, thank you, Tiffany, and thank you for allowing me to be here to participate in this very important event. I'm president and CEO of the Southern Christian Leadership Conference. That's an organization that Dr. Martin Luther King Jr. actually set up in Atlanta, and then he came to set up our charter here in 1961. We are as a civil rights organization, we fight to overcome injustices, segregation. We fight to empower children, empower and those who need jobs, those who are looking for better opportunities for their lives. And we work at economic development, and we particularly work and focus on voter participation, what's going on now, the fight for justice out of Washington and out of the state. So there's a myriad of things that we do, but some of the most important things are centered around justice and social justice and civil rights. I'm really feel that it's really important that we participate in this discussion, because as you look around, and you just stated that the high percentage of African Americans that, because of poor health, because of habitual things that have struck their lives, they need limbs, they need livers, they need all types of things. And it's really important that that we make them available, but at the same time that we begin to understand the importance of organ donations and the importance of sharing, in the final analysis, sharing what we have that the Lord has given us to go back so that someone else can benefit from it.
Yeah, it is important for us to make sure that we're continuing to get informed and educate. Lavinia, Ms. Brooks, same question for you. Do I need to repeat it?
Oh, hello, Tiffany. Hello, everyone. I'm so honored to be here today. Yes, my name is Lavinia Brooks. Everybody calls me Miss Vinny. I am a OneLegacy ambassador, and I am also a heart transplant recipient. I received my new heart in 2015, and it was a long journey. My journey began in 1999 when I was feeling a little tired, and so I went for a physical, and I was diagnosed with cardiomyopathy. And as a single mother, we don't take time to be sick. We have to take care of our kids. So I really didn't focus that much attention to it, unfortunately, and the disease progressed. And in 2004, I was diagnosed with congestive heart failure. And that's when my whole life changed. And ultimately in 2014, I was placed on the heart transplant list because my heart had become so weak that I couldn't leave the hospital. And I'm just trying to make it real quick. And in 2015, after waiting 6 months and 23 days in the hospital in ICU, I received my new heart. And so I wanted to give back, to my fellow heart, transplant patients, the people who are waiting, because waiting was the hardest part. Once I became a OneLegacy ambassador, that's what I wanted to do. And so I focused most of my attention on heart transplant recipients because that's my experience and I understand, the struggle. And so I'm an ambassador to hospitals and I'm also an ambassador to cities as well. And so that's why I'm here today.
Thank you, Lavinia. And then for those that do not know me, let me just share. I am the head of production and community engagement here at OneLegacy, and I oversee the development, brand strategy, and production here. And I see that this conversation is very important because I am a Black woman myself, but also I have family members that have received organ transplants or have been on the waiting list in need. And so we know there's a huge need in our community of colors, particularly due to the prevalent health issues like diabetes, high blood pressure, heart disease, and overall in time that can result into a need of a life-saving transplant. So we can talk about some preventive measures, and then we can talk about in general, how do we just take care of ourselves and make sure that we become our own advocate. Also, I do want to share that this is American Heart Month. And Ms. Vinnie, I'm going to come to you with the first question. Let's talk about some of the prevalent diseases among our African Americans and how to find a healthcare provider that could be an ally and listen to their needs.
Well, as for me, I dealt with gestational diabetes from pregnancy, and as we know, a lot of Black Americans suffer from diabetes, and mostly because of our diet. We eat a lot of traditional foods, which are fried and covered and coated and all kinds of things that, elevate our blood sugar. And I was a great fan of fried chicken, as most of us are. And those are the things, because, healthy foods really aren't available to us, weren't available to us in communities of color. And when they are available, they're at an increased cost. Everything costs so much, so sometimes, especially when you're a single mother, it's a lot easier to drive through McDonald's than it is to make a healthy breakfast if you got to rush off to work. You know what I mean? So convenience it sometimes is more important than our health when it comes to, living day to day, unfortunately. And so these are the practices that we put in place, and our bodies are affected by it in a negative way. And so, yeah, I did suffer with diabetes, and that also caused the problem, the cardiomyopathy with my heart, right? And then I also had a lot of stressful situations in my life, and unfortunately, I suffered from broken heart syndrome, which is a real thing. A lot of stress, in your life can affect your heart as well. And so all of these things, that we deal with from day to day can affect your health. And fortunately for me, though, as a woman of faith, I have learned how to pray the word of God to alleviate stress. I pray the word of God to manifest healing in my body each and every day. And those are the things that I put in practice. As for finding a physician that will assist with the health issues that we deal with as African Americans, they are few and far between, unfortunately. That's my finding anyway. Most of the doctors that I encountered in my 10-year heart transplant journey was doctors that, just want to, they just gave me a bag of medication and said, go home and have a nice day. And I'm not blaming them at all, but, I don't think that they understand. They weren't educated on how to really deal with heart disease at the level of sickness that I was dealing with. there's not that many transplant cardiologists out there that understand. And by the time you reach a transplant cardiologist, your health is on a serious decline. Because I didn't even know anything about the possibility of having a heart transplant until my ejection fraction was 12% and I couldn't leave the hospital. That's too late. Perhaps if I'd have been educated earlier in my journey, there could have been some preventative measures that I could have taken that would have nipped in that process, and possibly I would not have had to have a heart transplant.
Mm. So Vinny, did you discover a doctor that was able to help you in your journey, or was it reading? What did you do to become your own advocate?
Well, I was very fortunate. My very first cardiologist back in 2004, her name was Dr. Ruth Strauss, and she took a liking to me. We hit it off immediately. And, some things happened in her career, things happened in my life. And unfortunately, she was no longer my cardiologist after a couple of years. But, as God would have it, in 2014, I was rushed to California Hospital with congestive heart failure. I couldn't breathe, I couldn't walk. I was very, very sick. And she happened to be the chief cardiologist at California Hospital. And she saw my name on the list, and she came to me, and she remembered me. And so she's the one that began to educate me on heart transplant, the possibility of having a heart transplant. And she gave me a lot of literature to study. She talked to my family, and she spent long hours and many, many days. I was at California Hospital for 30 days, just waiting for her to do the paperwork to get approved to be on the transplant list. So it was a long, drawn out procedure just to get to that point.
So as we talk about, heart disease, Rhonda, tell us about some of the other prevalent diseases in the African-American community. And, same question, how to find a healthcare provider that is an ally and listen to their needs.
Great. So a couple of things that Ms. Vinny said. One, understanding how to advocate for yourself is an important thing, and your loved ones when you're in a situation like that. But also finding a provider who's going to go to bat for you and make sure that you get access to all the available options that you have the right to have access to as part of your patient rights. And I think it's important for us collectively to understand that we have the right to choose another doctor, right? If we feel that we're not getting the best care, or that doctor isn't showing us their concern and really advocating and navigating through the system of care on our behalf, that we have the right to make a different choice if that situation isn't working out for us. And so we work a lot to educate individuals around what they can do and how to have a conversation with their provider, how to navigate through the healthcare system, knowing that they should be and have the right to be at the center of decision-making for their care and participate in that process as well. And so again, if you're not working with a provider who wants to partner with you in managing your healthcare and helping to make decisions, then I think looking for another option or provider would be important. And so I wanted to list a couple of resources, or mention a couple of resources. The California Medical Association has an arm of it called NEPO, which is an abbreviation for the Network of Ethnic Professional Organizations. And so every provider or physician or medical professional of color is part of that NEPO network. So if you're looking to find someone that's more culturally relevant and appropriate and you feel more connected to, you can go to NEPO as a resource. There's also the Association of Black Women Physicians organization. It's comprised of Black women physicians across the state that have various specialties. So you can go to their website and try to find a provider perhaps that's either in your network of care or in your location. So if you're looking for someone you can, again, identify with in a different way and work with, that's fine. In terms of some of the statistics, like we focus on everything from maternal health and infant mortality to chronic diseases or disparities in chronic diseases, cancer, rare diseases like lupus and sickle cell, and even end of life issues. And so It's important, to start from the very beginning, even before baby's born, to make sure that the mother's healthy and can deliver a healthy baby. And so just knowing some of the statistics when we have to think about why these things happen in the first place, we know that Black women tend to succumb to, situations or complications at birth or giving birth 3.5 times more than Caucasian women do. Previous to a report that came out last fall, it was about 2.5 times. So now we know that Black maternal health disparities are worse than what we thought. We also know that there's evidence that proves when a Black infant is delivered by a white physician, they're 3 times more likely to die during birth than most Caucasian babies. So I can go on and cite a lot of statistics about disparities from birth to death. So it's unfortunate that this is something that we have to deal with. And, in the context of our conversation today, when it comes to end of life issues, like if you're a kidney transplant or need a kidney transplant, and we don't know that that option is available to us, or you need a heart transplant and don't know that that option is available to us. I think in terms of being more health literate and asking for, I a lot of times ask, what would you do if I was your daughter, right? If I'm talking to a provider, or what would you do if I was your sister? Would you make that same decision for your loved one that you would for me in caring for me as a patient? And so I always, do ask that question just to see, if they are really going to bat for me like they would someone else, right? Who may look like them or they can connect with and identify with in a different way. Also, just knowing what your available options are. If you're a cancer patient and a stage 4 cancer patient and all else has failed in terms of commercially available drugs or therapies, you may have the option or may have, a clinical trial that could be available to you to participate that could extend your life. So I think just knowing that we have the right to ask questions and being well informed about your health condition, whatever stage that may be and whatever that may be, is an important thing to know.
Thank you, Rhonda, for all of the detail there, which is really important because it just talks about how we, want to find a doctor who's an ally, but we absolutely have to advocate for ourselves. And there's 106,000 people currently waiting on the transplant list, men, women, and children. And about 30,000 of those are African-American waiting, which makes them the second largest population waiting for a transplant list right after white Americans. And we're such a small fraction. And so it's nearly a third. And I want to talk about, how is organ donation and transplantation perceived in our communities of color? Is there a gap and what can we do to close it? Pastor Smart, you are a pastor and you have congregants. Talk to us about what do you hear or how do you know organ donation being perceived in our communities?
Well, I wish I could say they're really being received in a very positive light, but it's really not. Organ donations is something that is new, to African Americans in this day and time, and it's something that we look negatively on for many reasons. Some of the reasons is because of the past disparities in health just around African Americans when they're alive. And so when our bodies, we don't trust people messing with our bodies, and we don't go to the doctors like other minorities. Also, we don't go to the doctors at the levels we should to take care of our health. Or when we do, it's been a lot of times we've been caught up in the negativity of just the whole process. Now that just our look at medicine is changing over the years, with Covered California offering a wide spectrum of health instances for African Americans. Then we can focus and target specific doctors or specific treatment plans. Now, we're behind the curve, but we have to get in front of the curve on this so that we can begin to have the healthy bodies and the healthy relationships with doctors, so that we're not afraid and that we're getting good health care. And then when that happens, then we can segue into the fact that we need we can make those end of life decisions that, yes, I want my organs to be donated. I feel comfortable and I feel good about it now, that it's important that I make sure that my organs may I say it this way, while my spirit may go up, my organs can go to other people that can be very helpful, that they're needed. So, all of that contributes to how we look at it, and African Americans look at it, at organ donations. And it's really a time that we have to wake up on this, and we have to wake our people up on this issue, and just say, it's just time. It's okay. Nobody's going to rush. You're not going to go into hospital, and because you're an organ donor, that you're going to be all of a sudden rushed, and they're going to get your organs before you're still breathing. No, those are myths. That doesn't happen. We have to inculcate that into our people and let them know that you have good insurance when your body finally wears out. If there are organs that can be used, you've already put them in the system, and so when you're called home, your organs are going to stay here. I mean, that's a simple way of saying it, but we have to educate our people. We have to instruct them and make sure they clearly get it, that there's nothing wrong with being an organ donor.
Thank you, Pastor Smart. Absolutely. You said a lot to unpack there. And there is, you just talked a bit about medical mistrust, myths and misconceptions. And it's really important that we, I think, outside of just becoming an organ donor, right? Let's educate ourselves. Let's get informed, so then we can make informed decisions, because that will then lead to us making a decision to understand that organ donation is an opportunity for us to give the gift of life to someone else. And particularly in our community, there are a lot of barriers in getting folks to register. I know Vinny just recently was at the DMV, where a lot of our registrations take place, and she was talking to some of the community members there in Englewood. And talk to us, Vinny, about some of those barriers that may exist with the Black community registering to become donors.
Well, unfortunately, the Black community is still suffering the effects of the Tuskegee experiment from 1932 to 1972, where for 40 years, Black men were tested, and, syphilis and all of that, that was a real thing. And so, our elders are still traumatized from that. And that's where the misconceptions are coming from, because they still believe that, if you go to the doctor, they're not going to care for you. They're going to, try to take your organs from you and not save your life. So, but fortunately, for me, organ donation is the new normal. It's a way that your life doesn't end, but it begins again in someone else. I often tell, people that when I talk to them. And so when they meet me, they're really genuinely surprised that I'm a heart recipient, and that it actually worked, and that's what I let them know. Organ donation really works. It really saved my life. They really cared for me. I really made it through. I'm really still here, and it blesses them, and it encourages them. And a lot the times they will register once they actually meet someone that it, like myself, that it worked for, And so that's why I always say we have to educate the youth so that they can educate their elders and their parents on, the truth about transplantation, that it really works, because they don't know about the Tuskegee experiment, they just know about what takes place now. What's happening now is that it really works. And so usually that's my target. And I also encourage families to educate themselves on the options that they have, in healthcare now as it relates to transplantation. Because when I was going through my journey, I really didn't feel up to doing any research. I was so sick. I didn't really, take the time to do all those things. And if it wasn't for my wonderful son, Tony, back there, he did all the research. He talked to the doctors. You know, he made sure that everything was okay for me. And he was only 21, 22 years old at the time. And so these are the things we need to teach our young adults on how to care for their parents when they're going through a health crisis.
Yeah. And so as we talk about, I just want to stick there on strategies, actually. And, we're coming out of a pandemic, maybe. Rhonda, talk to us about what we've seen over the pandemic to improve health equity. And this is a two-part question. And then I want to relate that to organ donation. So what are some of the strategies that we've seen?
Yeah, so I just want to say, COVID definitely did a couple of things. So I always talk about it in the context of it being a double-edged sword, right? So we knew that there were health disparities that existed in communities of color, the BIPOC community, especially in the Black community. But on the other side of that, and I should say it exacerbated those disparities. And on the other side of that, it also brought to light those disparities, but it also sort of opened the door for conversations to talk about what's happening in the Black community and other communities of color. And also, I think what's at the root cause of this problem, and it's about racism, the impact of racism on Black and Brown communities. So I think, while COVID really was devastating in a lot of ways, it also benefited the community in other ways. And so we took, what was happening in 2020 as an opportunity, even though I call it the perfect storm of opportunity. So the strategies that arose out of that for us was really to reframe how we look at health equity. And the framework that we came up with was really viewing it through the lens of racial justice, social justice, and environmental justice. And so that frames the work that we do. So you can't really do one without the other when you think about the construct of health disparities and how it impacts communities of color. And where that all comes from, right? There's a lot of institutional racism, and we have to acknowledge that. There's a lot of implicit bias that happens within the healthcare system when we are seeking healthcare. But I think there are ways to overcome that. And part of that is really being more knowledgeable and being more health literate and being able to understand how to engage in conversations with their healthcare provider, navigate through the system of care, and again, being part of that decision-making process and being well-informed. And so fortunately here in California, part of that strategy to address health disparities comes in the form of legislation, or has come in the last couple of years. There have been, marked legislation here in California that hasn't happened in other states that really address health disparities, and some at the system level, like SB 464, which is the perinatal equity bill, which requires providers in that space to go through implicit bias training with the hope of better outcomes on the other side of that. So it's a complex issue, but there are strategies that can be effective, when we talk about dealing with individuals and patients and communities, and also with policymakers who can have an impact on what happens. And also, I'm part of a committee now that's looking at health equity in the context of healthcare plans and holding healthcare plans and insurers more accountable for making sure that there's equitable care and coverage and delivery within the healthcare plans that they manage. So,
and that's the problem. Healthcare. We would get adequate health. We would be treated just the same as anybody else if we had adequate health care. The first thing they ask you when you go to the ER is for your ID and your health care, your health insurance. And if you don't have decent health care, you're not going to get decent care, period.
Right. Yeah, you're absolutely right. I mean, there should be regardless of what we know that unfortunately, sometimes what type of healthcare coverage you get or you have, it dictates or can influence the type of care you get. So
that's right.
If you look at, unfortunately, someone with a cancer diagnosis, right, who has private insurance versus someone who has Medi-Cal insurance, right, and the reimbursement rate that happens in both of those situations. Unfortunately, it's about the profit, that certain practices and providers will get for a privately insured patient versus a Medi-Cal recipient. And so I
Go ahead.
So I have seen evidence recently in research that proves that sometimes health disparities for Medi-Cal recipients just stems from the decisions made about the quality and type of care. So they don't always necessarily get the current standard of care when it comes to cancer treatment, like a privately insured patient would, which is unfortunate and shouldn't happen, but that's the reality. That's part of a healthcare system that is already kind of broken to begin with, unfortunately. And so when you talk about accessibility, availability, and affordability, right, you know, it's a challenge. It's not necessarily a level playing field, even though, you know, healthcare is a right, not a privilege. And having access to equitable, affordable, quality care should be what we all experience, not just the chosen few who may have better insurance than another individual.
So Rhonda, you know, I told you it's a two-part question, and I do want to just, you know, get this out there. As you talked about the framework that you have been developing with your organization, social justice, environmental justice, or you even talked about the accessibility, affordability, and availability. Tell me, how can these strategies, from your perspective, help improve health equity in relation to organ donation amongst African Americans?
So again, I think that first we have to make people aware, right, of that this is an option that exists for them. So if you're someone like Miss Vinny, like, I don't know that she was aware that that was an option for her when she was going through her situation. So again, focusing on strategies that can improve health literacy across the board and educating people about not just their healthcare condition, but what they have the right to have access to. And, you know, regardless of what their health condition is, I think is an important first start. And then also on the other side of that health literacy equation is doing our part to educate providers, right, on how to deliver more culturally competent care and being and more cultural humility when they're dealing with patients who may look like them, who come from different backgrounds, who may not live in the same communities that they live in, but just understanding how to kind of deal with them and also not necessarily bring into their decision-making maybe some myths or perceptions that in some cases they were even taught in medical school when they're dealing with patients of color, right? So I think those are some important things. You have to kind of meet the, you have to meet the rubber or where the road is or something like that. Yeah, so it's like right there.
The rubber meets the road.
Thank you, or thank you for correcting me on that, right? So I think right there at that point is where the biggest opportunity is to make change, right, on both sides of that. And so that would be what I would suggest, or I think is probably the most critical thing, aside from some of the policies that we have been able to pass or implement here, or potential for those in the future.
Thank you. So Pastor Smart, I'm going to come right to you. You know, so I mean, tell me and tell us, how can we work together to provide more information about the importance of organ, eye, and tissue donation, particularly in communities of color and African Americans specifically?
Well, I'm a pastor, and all of my life, I worked with churches and collaborations and coalitions around issues like this to get the information out there, to get people in the churches, to get people before the associations, before the conferences, to make sure that healthcare professionals, and donor professionals clearly can articulate to these bodies the importance of this matter. And I think that should be one of the areas we tackle. I think we also, as our sister said, we need to go back to younger generations and empower them to clearly understand what tissue donations is all about, and how that is it's almost like we're coming full circle. We're in the end, we're going to give up things or share things. And that's the way I like to put it. Tiffany, we are sharing. You know, when someone gives a donation, they are sharing, and you're just giving one of the ultimate donations you can give. and an organ or limbs, or whatever. I mean, I know we work more with the organs, and to think if our sister here had not had a heart, I mean, someone that was there at the time to give her heart that she needed, where would she be? And there are a lot of times that we have to really not preach, but we really have to teach to our young people and to our elders that in middle age that, the list of African Americans that are needing organs is heavy. And we are, so it's like a process of sharing and giving, and you're giving back almost because in the end, it could go to someone, it could go to someone that's close, or someone that, or, just an African American, that this is important. This is important that we tread our part on this, and that we do our part. And so I stuttered because, I mean, I was going to wait, but, I have, being a part of this OneLegacy, I have decided that I'm going to, I'm going to become a donor, organ donor myself. And during the month of April, I'm going to make a proclamation about that and do it in at a demonstrative time, in a demonstrative place, in a time where I can encourage others to do the same thing, and have a campaign going, because it's not right. One of the things as a social justice person, I always say that what makes civil rights people operate is that you cannot ruin or expect one person to have a right that you don't have. Like, everybody has to have the same rights. And so that is, if I can go in the store, and buy some strawberry soda, then everybody, it should not be something that is discriminated. You can't say one class of people or one race of people. Everybody, if one person can do it, everybody can do it. So there's a flip side to this when it comes to donations of organs. And that is, if you can't expect one group of people to do it and not another group of people to do it, and that other group of people is benefiting from it like the others. You got me? And so that's what's real important here to me, that everybody should be an organ donor, because everybody is benefiting from getting those organs.
Pastor Smart, very, very good point. And Rhonda, I know you want to say something here, but with the African Americans being such a minority group, we having the biggest need, it is important that we step out there and that we are giving back and registering to become donors. And I think just from a community health perspective, right, that we're supporting what our needs are. And first, we're getting educated. I'm asking people to get past, the misinformation and some of the mistrust, but do that by educating yourself and making yourself informed. So then you can make some of these important decisions that will, help others down the road. Rhonda, I know you wanted to say something.
Yeah. I was going to say, thank you for saying that, because that was the point I was going to make. Like, there's a lot of misconceptions, misperceptions that get in the way of us kind of taking advantage of what resources we do have available to us in the healthcare system. I think, Ms. Vinny pointed some of those out. Like, yes, the Tuskegee experiment did happen. Yes, the Henrietta Lacks story is true, but there are guardrails that are in place now that prevent those things from happening again to anybody, regardless of what your skin color is. But so when we talk about educating the community, it's doing that in a way that dismantles those perceptions and misconceptions and the myths that are in the community versus the facts that exist. So, we're happy to work with OneLegacy to do our part to help educate, our community about the importance of being a donor, right? And what that really means and how people can leave a legacy and save a life by doing that. If they make that choice to, help others, to the Reverend's point.
Listen, some very good conversation, and we can continue. I do want to turn to the chat and answer some of the questions that we have here before we get off of our town hall today. Very, very informative conversation. So I have one person, and this is to Pastor Smart. What do you think the best way to educate people of color will be, where we can make the biggest impact educating these communities? Is it better to have a person of color do the education? It seems like, and I'm assuming this is from a white person, it seems like it would go over better if it was from a person of color versus a white person. What's your thoughts?
I think, first of all, I think it would go over better with a person of color, only because they, based on what our sisters have said, they're more apt to understand it from someone that looks like them and has been what they have been through, what they've been through. Our sister here that has had a heart transfer, she knows it, and she would be excellent too. She would be a great person to teach other African Americans about the importance, like she has been doing in front of the VAs. So yes, it's just one of those issues that, because of the racism that has been around it, it's just I would feel more comfortable too as a person coming to me of color and saying, hey, look, brother, this is the lowdown on this, and just rap to us like she does. Yes.
Does anyone else want to jump in on that?
I always win when I speak to our people. I always win. I always do, because we're visual people. We want to see somebody who looks like us and who has gone through it. And then at the same time, I always encourage them to be compliant. To be teachable. And not resist. The technology and the advancements that the medical profession has made in the area of transplantation. It's not like it used to be. Things have changed. And we have to, really emphasize that and give them the comfort and the peace that, that they need, to trust the system. It's all about trust. And it's all about fear. We need to eradicate the fear factor. They're afraid, basically, because of the history of what has happened to us as a people. And so if we could break the fear and and show them the love and the power and the positive side of transplantation, then we will be more victorious in our efforts.
Yeah, and also, as we talk about some of the fear and the misconceptions, one thing I hear a lot is some folks will say, I'm too old to donate. And you're never too old. You make that decision to become an organ, eye, or tissue donor. The medical professionals will determine if you're medically suitable to become an organ donor. Some say, I'm too young. You're able to register and become a donor as early as 13. It doesn't come legally binding until 18. But, having these conversations, as Vinny said early, teaching our younger ones, they can have these conversations around the dinner tables or with their families and their friends. And it becomes more widespread. So pushing education is really top priority, particularly in our community, so that we are very well informed of organ donation. So I have another question here. Well, actually, folks are saying this is a great town hall. This is really good. They were very, very pleased with some of the resources that you provided, Rhonda.
Great. I see Antoine is on the call.
What are some effective ways to address misinformation and past experiences that are prevalent? Talk to us about that, Rhonda. You talked about some of the guardrails in place, but people are very likely to still be resistant to seeking out information or talking about it. And that came from, I believe, Antoine.
Thanks for the question. Yeah. So again, I think, probably the average person doesn't know, unfortunately, or the average patient doesn't really know that there's actually a thing called the Patient Bill of Rights, right? And within that, you have the right to all the things that I talked about before in terms of what to ask for, what you should expect and receive, the type of experience that you have with your healthcare provider. But I think it goes down to really being well-informed. Part of it is knowing our history, right? So that we won't repeat the past, and that we can use that information to create a better future for us individually and us as a community. And I think just going forward, when we talk about health and managing our own health and wellness, really focusing more on prevention, I think, is an important thing. So, within the healthcare system, I've heard people refer to it as sick care versus healthcare, because the first course of action is always to provide some sort of pharmacological solution, as opposed to really thinking about what is the root cause of this patient's issue. Is it a nutrition thing, or physical activity, or lifestyle management, or whatever? But when it comes to chronic disease, I think those are most of the contributing factors that relate to those health conditions. So I think all those things are important to know and to be well informed about. So hopefully that answers your question, Antoine.
And he said yes. It does.
Great.
Great. I also want to, just say, in terms of, seeking out a health provider or knowing your own health, getting your checkups, not waiting until, you feel ill. Oftentimes we do that in our community, or we'll self-medicate and even self-diagnose with everything at our fingertips and Google right there. But it's really important to get those checkups regularly and frequently. That way we're not waiting until there is an issue that is irreversible. And so preventative measures are very important. And I also like to look at organ donation, not just as an end of life conversation, but a conversation that we can have now, because what we do today affects tomorrow, and then how we can, determine. As we get ready to wrap up, are there any closing remarks from any of our panelists?
I'll defer to Ms. Benny. I'm sure she has quite a few things to say to make sure that people, when we have this conversation again, that we're telling a different story. So I'll defer to her.
I just think that it's very important that we, like Tiffany said, talk about it. Talk about it at the dinner table, talk about it in our churches, talk about it, in open forums, wherever we can, just lend our voices more regularly to the cause, and be that light that breaks the fear that has tormented our people for so long, as it relates to trusting in your doctors. And then also we need our medical professionals to stop looking at, our insurance cards and look at us as people, in general, that need help, that need care, And then it's also very important for us, as a people, to live a healthy lifestyle. I'm living a healthy lifestyle now, but if I did it 30 years ago, I wouldn't be in this situation. You know what I mean? And so that's just so important. And to make, healthy choices more available for us, for our children, and our elderly. That's key. Nobody wants to have a heart transplant. I mean, but if we could prevent it, then that, because not everybody even qualifies to receive a heart transplant. I have loved ones who died because they were rejected. They weren't qualified to be on the heart transplant list because they were too sick. Several members of my family didn't make it, and I did. And so I feel so blessed to have had this gift, the second chance at life. And so that's why I do what I do, and to let my story, educate others so that they don't have to go through what I went through. But if they did, they know what to do.
Yeah. Thank you, Vinny. It's really important. I do have one other question I want to ask. Do we think addressing these barriers will create greater equity on the registry or in authorization to improve organ donation in our communities of color?
Yeah, can I?
Absolutely.
Yes. One of the things I was going to say with Vinny was talking is, I mean, Tiffany, is the fact that we need to make sure that we get not only health, we get housing, we get proper diet. We need all the other concomitant concatenations of issues that have really disturbed in the lifestyle of African Americans. And we have to, the diet, the housing where we live, and our health. And then as we talked about, the right health decisions that we can make. All of that becomes those variables into our life that really causes us to be healthy or causes us to be unhealthy. And that in itself will bring about a change that we really need. This is important to address them at all times. But but we also have to look at those other issues. Now, this is not your area to look at it, but we as a community have to look at those other areas also.
He's absolutely right, because if you're homeless, you won't qualify to be on the heart transplant list, on the transplant list, period. You have to have a support system. You have to have housing.
Yeah, and and it runs deep in our community, and because there are so many social determinants or pre-existing conditions or issues that really get in the way sometimes of our everyday needs and our health needs. We really have to work together and know that this conversation doesn't end here. It starts here, and then that we really need to continue. I want to thank our speakers. You guys did an incredible job. It's really important that our community hears from us. And as one of the questions were asked, does it help for them to hear from people that look like you? Well, yes, in fact, it does. And so I really hope that folks will be able to walk away from here with some information, whether it's some of the resources that Rhonda shared or just a conversation, that you're a little more enlightened, and that you have some information to make more informed decisions. This topic is very, very important, and it does not end. As I said, we look forward to working with all of the ones on this call today, but also with our guests in our community, which is you. We want to hear from you. Let us know what conversations you want to hear, what resources we can bring to the table, and what we can do so we can continue this dialogue, but also get active in our community and do the work that's needed. Please go to our survey, submit questions, and even give us some topics so we can be prepared for the next town hall that will be coming soon. If there is nothing else from our panelists, I want to say thank you guys so much, and we will see you soon on our next episode of Connecting the Dots.
Thank you, Tiffany.
Thank you for having me.
Take care.
Thank you.
Happy Valentine's Day.
Happy Valentine's Day.
Happy Valentine's Day.
Happy Valentine's Day.